So updates, it is bittersweet. So we have our fifth grade return, some great pictures Nancy Bradstreet put together for us. Lots of photos on social media, and obviously I'm sure we know I was in, I didn't get to all the buildings by tonight, but the ones I stopped into, students were very excited, teachers were very excited. We did put out through the Office of Instruction some reminders for our teachers in that really this is sort of like it is a back to school. And so I'm happy to hear some comments tonight from parents, and we have received some positive emails as well, in the sense of this was really about bringing cohort A and B together again, and taking that time not to dive into assessment or rigorous instruction, but really to take some time for that breather and get kids back to that process. And so lots of great social media pictures and tweets and positives around how our staff were able to bring kids back and make them feel safe. I walked through Cobbles on last Friday, and I would say every classroom I asked how students were feeling about coming back at kindergarten through fifth grade. And every class said the same thing. There were students who said they were scared, and there were students who said they were excited. And so in my role, I was shifted scared to nervous, and I think we talked about that really was the feeling for all kids, that there was a continuum of really excited and also some nervousness for coming back with more kids. But once we got everybody in there, we've heard nothing but positives. I'm sure with all of our kids, not everybody had the best experience, but so far, all we hear is reporting of just positivity and coming back in. There's that picture there of our music classroom down on the bottom, and you can see that's 6 feet of distance. Just before this new guidance, that would have been 12 feet, so there would have been about 2 kids in that picture. So a pretty positive return for K-5. However, that leads us to this piece, which is the last board meeting when I talked, we were very excited about coming back. We had worked within the means we had. The guidance we had, as you know, was not updated since August, and that frustration level was there, and we continued to push forward. Since that board meeting, the state released updated guidance. And so it's great for some things. The mandatory face mask policy, we sort of always thought it was mandatory, but they made it really mandatory, I guess. The barriers aren't recommended, and I'll talk briefly about barriers, is that the barriers and why Penfield didn't use barriers, and most of Monroe County schools didn't, was because of the science around barriers, that they don't stop COVID. I'm not a scientist. I'm not anything more than an educational doctor. So if there was like an emergency on a plane, I can help them write curriculum. I can't do anything else. But we do trust in the science and the data around barriers, and ultimately why they were approved in the beginning, they weren't no longer approved and recommended because, and it does make sense, that COVID is transmitted through spittle, through air, and a barrier isn't going to stop that. And so that was a decision that most districts in Monroe County did make, Penfield being one of them, and following that science and data, which we said we would do. And ultimately, now barriers are not recommended. But as I mentioned earlier, the good news is for music and PE, the distancing shifts from 12 to 6 feet, which is helpful to get more kids in and do more participation. And then schools, really excited, this is what we were advocating for really strongly, was to lessen the distancing, the physical distancing from 6 feet to 3 feet. And so at first, this is great because we can get kids back at 3 feet. Actually, we can get kids back at about 4 feet, to be honest. In some classrooms, we need 3, and many others, we can do it with more than 3, but it has to be less than 6 to get all students back in. So we're ready for that. We've got our desks back in. We were very excited, as parents mentioned, as my own children were, as my wife was. And then that new guidance shifted to that CDC, so the level of community transmission. So schools can go down to 3 feet, it's pretty clear, as long as the community transmission rate is in the low, moderate, or substantial range, or you can cohort. And so at elementary, we can cohort. Kids are typically with their elementary school teacher for the whole day. And then when they go to art or music or PE, they're with their class. So that is the definition of cohorting. When we originally saw cohorting, Myself and another superintendent really looked and said, I think we can cohort our secondary schools through the means of using Infinite Campus. So even though at secondary kids go class to class to class, if we can follow them via Infinite Campus, I can figure out contact tracing. So we brought that to the Monroe County Department of Health. We brought that to our legal review, and we're told that's not cohorting. And then the New York State guidance made it pretty clear that cohorting means that you're with the same students or in the classroom together. So at a secondary level, that would mean kids teachers moving around. And I'll talk about that in a minute in the next slide. So we're talking about transmission rate. This is right from the CDC. And so New York State Department of Health says, look at the CDC for their guidance. I mean, their updated guidance is like 34 pages. It's not very long. It's pretty easy to read. It's on our webpage. I encourage people. I put out the email with the links to both the CDC and the New York State Department of Health guidance. So it is tied to transmission rate. If you can't cohort, then you have to tie yourself to the transmission rate. So how you figure out the transmission rate is, if you want to do the math, you take the number of new cases in our county over a 7-day period, add them up and divide it by 7.41 because we have 741,000 residents in Monroe County. So that's how you determine it. Or you can just go to the CDC or Monroe County webpage and they do the math for you. But I thought it was important to talk about how they figure that out because that was a big question. So Monroe County is currently at 241 cases per 100,000, and that puts us on this chart very strongly in the red high transmission zone. And so that means based on that guidance, based on the legal review of that guidance, and based on working with the Department of Health and even reaching out to the New York State Department of Health, they keep pushing us back to the guidance and saying that's what you have to follow. And so right now we're in the red zone. So this is also from the CDC, which New York State Department of Health links to. And these are the CDC prevention methods for a school system. And so you'll notice there's 4 color zones. There's blue, yellow, orange, and red. I'm sick of colors. I would just like to talk with no colors anymore, but this is CDC in New York State, so everything's tied to a color. So in the low transmission world, high schools and middle schools, I didn't put the K-5 on here because K-5 we can cohort, but focusing in on the secondary schools, middle and high schools, no issues if we were blue or yellow. We're not going to be blue or yellow for any time soon. I think that's true. But orange and red is where we live in red and we can get to orange. In the orange zone, which is that this area where we've got basically the 7-day transmission rate is between 50 and 99, or where we are is over 100. But if we get to that 50, 99 range, then all of a sudden we can use 3 feet distancing, and we just have to recommend using cohorting. So we could go back to what we talked about as using our Infinite Campus scheduling system to determine who is sitting next to every single kid. We're in the red zone, so based on the CDC, schools that use cohorting can stick with 3 feet distancing. Schools that can't use cohorting, that means you have to keep that 6-foot distance between students in classrooms. So 2 things. 1, September, we are going to open 5 days a week in September. I cannot do this. I've said it openly. I can't do this as a superintendent. I can't do this as a father. I can't do this as a husband. Opening up in 5 days, we have to. So we have our reopening committees I'll talk about in a little bit. But that is without question what we will do because we have time to plan based on this guidance. To shift into a cohorting model now, if you think about our high school and the number of courses we offer and how proud this district is about the number of courses we offer, and then say we have to find a way to offer all those classes, but have students sitting in the same room and the teachers moving, but the students staying together. In one class of social studies, 11th grade, American history, those students leave that class and go to 6 different math classes. So we can't cohort the kids overnight at the high school to make them all stay in one room so we can be less than 6 feet and cohort at the high school. The middle school, we could cohort, but we need time to do it. The middle school is easier to cohort because there's less choices at middle school. You take 6th grade classes, 7th grade classes. When you get to 8th grade, you do have some acceleration. But in terms of that is recreating the schedule, everybody's getting a new teacher, everybody's getting a new schedule, and we won't be able to offer some of the classes that we have right now. So we're not saying we can't. We're still digging into the cohorting at middle school, but the amount of change that that's going to create, we don't know if we can pull it off in time. So instead, what we have to continue to do, got to stop hitting that button and hit my button here. What we got to continue to do is advocacy. And I understand, and I wrote this down. I can remember it. Restoration of sanity. I really like that statement, because that is, without a doubt, that frustration that we hear here and the frustration I receive in the community when I am out at Wegmans or anywhere else. I understand it. I don't disagree, and I can tell you that every board member here fully is frustrated too. So we're going to continue monitoring those transmission rates. I'm going to be honest with you. I don't think they're going to go down. I don't think that with a 7-day average, we're going to wake up tomorrow and it's going to be 50. So therefore, we're not done. We're continuing to advocate for secondary schools to return to 5 days of in-person instruction. So how are we doing that? We're pushing hard to say, stop using the county-wide transmission data and use what we have. Student and staff COVID test data. We've got about, and please don't quote me on this, but I think we have about 75% of our families opting in for the COVID testing, the rapid testing that we're continuing to do in our schools. We've got that. It shows that there is 0 or close to 0 of positivity being found in our schools. We do have, and we put everything on the COVID dashboard, so that's on our webpage. You can go to the New York State COVID dashboard and see. We are not without COVID cases. We have students out right now with COVID, we have staff out with COVID, and we have students and staff quarantined because of COVID. So it's not like it's not happening, but we feel that we can still do it safely in our buildings based on the masking and all the other protocols we have in place. So we're continuing to push for our school-based metrics to be looked at. We're also continuing to push. Now, right now, Penfield zip codes are still in the red zone, but they're not 244 or 241. They're lower than that. So we're also advocating to at least consider using school district zip codes to figure out, instead of tying us all to the full Monroe County. And then also using the staff vaccination rate. So we do have anonymous data. We don't ask individuals if they were vaccinated because there's some HIPAA privacy there. But in terms of anonymously, our vaccination rates continue to increase. More and more adults are choosing that. It's not a requirement. We can't make it a requirement, but it's a choice. And everybody right now, as you know, in our area, you can get a vaccination if you want one. For a while, it was like a Springsteen ticket, and now it's more like REO Speedwagon. So, of 2000, not when they were great. But that's the reality, is that this is the metrics that we need to be using. So, the other piece here is then around our reopening committees. And I'm going to come back to something. But our reopening committees, we did meet as a full committee just to go over the process and what it would look like. I did send out an email with a link. It's on our webpage. You can go and see who's on all of the reopening committees. And we're going to be meeting. Those committees are meeting without me. So each committee has 2 facilitators. And they are going to be meeting regularly starting in May. Within the first 2 weeks of May, each committee is meeting on their own. And our goal is going to be to use this existing guidance, the most updated guidance that we just have, to focus on September. We are hopeful that that guidance will continue to become easier to work with maybe a new updated guidance in the summer or in June. However, we've learned that if it went from August to March with updated guidance, I'm not gonna bet on the state. I'm not gonna bet on the state restoring sanity. So. We're going to use this guidance now to figure out how we can come back full-time in September, whether that be 3 feet distancing, whether that be cohorting, however it might be. At our K-5 buildings, there's 3 of them. By the time September rolls around, we will have new space. Indian Landing's cafeteria is on track, I believe, to be open early fall. We've got classrooms coming at Indian Landing. The Scribner cafeteria will be back online, 4 new classrooms there, and then 4 new classrooms at Cobble. So we'll have more space at the elementary levels if something changes with that 3-foot guidance. And then our plans, our outcome of these committees is that they will create a working plan to allow for a full K-12 return. That is their mission. That is what they're going to be working on. And then we'll be sharing those plans along the way with the community, because we obviously need a larger community buy-in for what our plans will be for September. Well, we're planning, and I want to be honest and transparent, we're planning for a 100% virtual model. So there is a 100% virtual model reopening advisory committee. We don't know if New York State will require us to have a 100% virtual model again like they did this year. If they require it, we want to make sure we've got the best system in place. If they don't require it, it's going to be a very difficult conversation because it's extremely costly to have a 100% virtual program. If it's not required, it will be a conversation with the board and around how does this work and what does it look like. So I don't know right now, nobody knows if they will require it. So when we take a look at our reopening plans and this piece, we reached out to, trying to be, transparent, we reached out to our insurance company and we reached out to our legal advisors. And so this is what's tough. So I hear that other schools are opening in the red zone. We've made some calls, and some of them are able to do it at 6 feet distancing. They're able to shift. We can't do the 6 foot distancing. Some of the schools I know of across the state were able to cohort. For whatever reason, they could figure out cohorting because they maybe offer less classes. They're able to do it. They have the space. So I don't know yet of a district, I'm still finding and looking, that said, forget New York State, we're going to open at 3 feet and go for it. There are some counties in the state that we've heard of where the county Department of Health and the county executive says, I got your back, you do what you need to do. At the end of the day, they don't have the legal ability to actually do that. So as we look at reopening in our advocacy and our push here, we're not giving up on the secondary level. One of the speakers spoke and mentioned, yeah, I do. I've got 2 kids in middle school, and no matter how much frustration I hear from everybody, I'm getting it at home 100%. And so that is really this continued push for reopening schools. But when we speak to our insurance company and the legal piece, the insurance company is the one that is big. If I could just do something and it would all ride on my shoulders and I would take the heat for it, there's little in me that would say I wouldn't do it, all right, to get my kids back in 5 days. The comparison I got from our attorney was, and it makes sense to me, if you have a swimming pool, your insurance company says you need to have a fence around your swimming pool. And if you decide you don't like the fence and you take it down, your insurance company no longer pays if, gosh forbid, something happens in that pool because you went against your insurance. We have insurance for the Penfield Central School District to protect the taxpayers. And so if there is a claim, and there are claims for lots of different reasons, our insurance company supports us, just like it does for your home insurance. So part of that is tied to following all of the New York State laws and the Department of Health guidance for whatever we need to do, New York State education. If I knowingly go against it, we put our district in a spot where any insurance claim wouldn't be paid, wouldn't be supported. And so that doesn't fall on me, that falls on the full community of the taxpayers. And so that is something that we have to carefully consider. We work closely with Monroe County schools. They're all in the same spot right now. If they can't find a way to open at 6 feet at secondary, our Monroe County schools around us are in the same spot we are. We are meeting regularly, we are pushing, we are advocating, and we're trying to, again, say, let's use school district metrics. So that is where we are right now. The frustration level is there 100%. And we're going to continue to push for secondary. I will tell you, it doesn't make sense to me to use the county-wide transmission rate when we should be using our student and staff transmission rate. That makes more logical, rational sense to me. However, that's not the guidance that's there. And I encourage you to please go to the link, read the guidance, and reach out and let me know if you've see that a different way. But it has been reviewed by legal. It's been reviewed by our legal advisors as well as our BOCES advisors in that world that we live in. So I am frustrated. I can tell you the board is frustrated. They're in the same point. They have to look out for the entire district. They have to make sure that the district is protected in terms of legal lawsuits and such. And if we knowingly go against the Department of Health guidance, we put ourselves in a very difficult situation. And so that is part of it. We're not done yet. We are going to continue pushing. I was asked recently, when's our drop dead date? Like, am I going to come out and say we're not opening? No, we're going to continue pushing. My focus has been, if we can get kids back, if it's 6 weeks or 5 weeks, let's get kids back into school to return to some normal before summer starts. So we're going to continue pushing this. I will continue to do updates. There'll be another update coming this week on what we have learned and what we think we can do. And again, we're working with all schools across Monroe County. So that's where we are. I apologize. I went on a little bit of a tangent there, but it's frustrating. It really is. So we talk about what are we going to do after post-COVID, whenever that might be, but really next year. And so Dr. Driffel is going to talk through the budget, not mention it, and I just wanted to share a couple of things in here, is that we are adding 1.6 social workers to our current social worker setup. So one of the things in this budget, if approved, a social worker at Bay Trail will become full-time, as well as an additional 1.0 social worker to support the needs across the district, to really help support our TIG model, trauma, illness, and grief. We're looking at COVID return from school as trauma, as many people mentioned, and what our students are dealing with, and coming back into school. While that's a start, we also know and believe that we'll have to be working with students there. And then we're looking at district level support for whole student initiatives, an assistant superintendent role of equity and access. And so really what we're looking at is this board and this community has really been very supportive around the whole student initiative. We're the only district that uses that term, the support of the whole student, and really focusing on the uniqueness of every individual student. We've got, as Scott Dressler talked about today, some incredible areas of support for our students with disabilities and pushing them to really get to that highest level of diploma they can. We also have enrichment programs across the district that support students that need additional support when it comes to rigor and push. And so this position looking at is bringing sort of bringing an umbrella around a number of the initiatives we have, knowing that when we return back to full-time school, our students are going to be coming in and needing that support and access to the curriculum that we can provide and make sure that meaningful instruction is taking place. And so really the role of this position as we're building it is work collaboratively to support the needs of the whole student, social emotional learning, which we've really dug into over the last few years, equity and inclusion, and access to meaningful curriculum and text. And then also to lead and support restorative practices, to celebrate the uniqueness of each student and promote a safe and welcoming learning environment. Right now, restorative practices is off and running. If you have a child in cobbles, they're using restorative practices. They do restorative circles every morning. They talk through, they have morning meeting, and then when there's a conflict of any sort, they bring kids together to talk through it and listen and learn, because it shouldn't be about punishment, it should be about learning from behaviors. And we do that as well in pockets at the high school and in pockets across the district. But what we need to do is make that a full district initiative. So a lot of this does deal around the equity and making sure that every student, regardless of race, religion, creed, background, is that they all feel truly unique in our classroom. They see themselves in our curriculum. And when we talk about being a safe and welcoming environment, which I believe we are, I've got 2 kids in the district who love it, that we really want to make sure that we're listening to our students and focusing on what we can do to support them, especially as we come out of what we've been dealing with this year and coming back full-time in school 5 days a week come September. Questions?
Board members, any questions for Dr. Putnam? Lisa.
Hello.
Hi, Lisa.
How are you?
Good.
Question on the orange zone thing.
Yep.
Assuming we're moving to orange zone, I'm going to be hopeful here.
Sure.
How quickly could we get students back? And do you see this like going back and forth? Like if we go to orange and then go back to red, like what does that mean for our students?
All right, so that's a question we still don't have an answer to.
Okay.
Knowing where we are right now with 10 weeks left in school, I feel pretty confident that if we are able to get to orange, if that works and our numbers allow us to reopen, that we wouldn't have to go, if we go up to red, we wouldn't have to shift and close again. It takes 7 days basically. You know, that number is rolling, but it would take a week to shift that back up to red. And so in working with Monroe County Department of Health, our understanding is once we can open, then it would be around looking at each case. So the only thing that would throw that off, to be fair, is if there was a cluster of COVID cases at our high school. And it was a large number, and they couldn't determine if it was transmitting in school or outside of school. It's possible that we would have to close and go virtual 100%. Or if we have time, kick back into the hybrid model. So does that answer your question?
It does. Thank you.
Yep.
Any other questions or comments?
Yeah, I did.
Catherine.
But I'm trying to formulate my question. Tom, you had mentioned about the, hold on, let me see if I can find it. Okay, the continued advocacy for secondary schools to return by using school-based metrics.
Yep.
And so I'm assuming that all of the schools in Monroe County, they're all banding together, you on the superintendent level with
Yep.
the other superintendents doing the same thing. You taking this to Dr. Mendoza?
Yes.
Okay,
Yeah.
and so he knows this push is already underway?
Yep.
Okay.
Yes. And sorry, I laughed in my mask because we just met with him again today, shared this information, and continued to push. And so, he doesn't, if you look at the guidance, the local Department of Health doesn't have the power to approve our reopening plans, but they do have to enforce them. So if we open and we are against the New York State guidance that's there,
Right.
we run the risk of being then told we have to shut down because we're not meeting that guidance.
Yeah.
And that has happened across the state. I mean, it does take, there is a COVID hotline. If you think that a business or a school isn't following the COVID rules, then you can make that call, an investigation happens, and that could happen. All it takes is somebody to say, I don't like what's happening, and call. So he knows this. I would say, I don't want to speak for Dr. Mendoza because he's not here, obviously, but he's not against this. He understands the merit behind it.
Yeah.
There are school districts in Monroe County that have 0 COVID cases in their school. Like, they don't have any. Like, we know we have some, we deal with them on a daily basis, and we work through it. And because of the 6-foot distancing we currently have, we're not seeing large-scale quarantines because of school. Right? Because kids are sitting 6 feet apart and they have a mask. Therefore, they're not being found as contact tracing. If we're at 3 feet, we still think we're okay. But again, it goes back to that transmission rate. But so as frustrated as we are, there are districts in Monroe County who are just as frustrated because they don't have any positive cases of
Yeah.
COVID at all of students or staff.
Yeah.
Right? But they're still under the county-wide transmission rate.
Right.
And I tell you, if we look at our transmission rate and just use staff and students, I can't give you the number, but it's low.
Right.
But
it's always been low.
it's always been low.
Yeah, we've always had that because of the protocols in place
We've,
and
we've
whatnot.
had, I think it's fair to say we've had spikes, and we know that in our district, but we've never been anywhere near the county transmission rate.
Yeah, okay. All right. Well, I'm glad to know that that kind of advocacy is, that on the county level, that it is recognized that this is going on.
And we have been, put out emails to our community and pushed around giving emails to Dr. Zucker of New York State Department of Health. We know that I've spoken to people who've sent emails to him. I know the board has as well.
Yeah.
I did just get a response after a month from the New York State Department of Health that just said, here's the new guidance. So
Yeah.
it is frustrating.
Yeah.
And we're at this point where I totally understand some community, including my children, that just said, throw caution to the wind and just go for it. But it opens up a whole lot of other issues that we've got to make sure, on the other hand, that we do have to protect the district as a whole. We can't do anything if we're completely going outside of the rules.
Well, I think that's a very good nuance to be pointing out because I don't think that's on anyone's conscious thought process because everybody's coming at this
I
like
want to open.
we want to open. Exactly.
Yeah. And I think, on one hand, it's K-5 is great, right? It is. I don't want to knock that. We celebrate that. That's wonderful.
Yeah.
But we heard from, even Abby mentioned it, right? So you've got high school kids who've got younger siblings who are heading off to school. Right? And maybe at high school it's different, but if you've got a 5th grader and a 6th grader, that doesn't seem fair. It's
No.
not. And that's
That's
where we're
correct.
going to continue pushing for this. We're not
Right.
saying, we're not drawing a line in the sand, saying that if we can't make it happen by next week, we're not going to do it. We're going to keep pushing. You know, we got here because of a lot of pushing and advocacy. I am not giving up hope that we're not bringing back our secondary students.
Yeah.
I know the board's there. I know, and I think it's fair to say, not every parent is ready to come back. They want to make sure we're doing it safely. We do have a virtual option, and I'm also telling you, we're going to do it safely.
Yeah.
We're not, you know, masks are mandatory, and the
Absolutely.
cleaning and everything else that takes place is there. But it is frustrating, and I really have to stop talking about frustrating because I can go on for a while.
Yeah, but it really is.
It is.
So I think we can all agree about that. Okay, well, thank you.
You're welcome.
So Tom, you mentioned that it is frustrating for you and for the board. You know, it is very frustrating for the board. You put us here in a position of responsibility, and we take this seriously for every student. And I would tell you that if there was a way we could do this with all the things that Tom explained, we would be doing it. I don't think there's any one of us who's happy about this. But this is the job you gave us. We take it seriously, and we're not going to stop trying. We advocate, as Tom says, with any representatives we can talk to. We advocate through our individually. We do it through our Monroe County School Board Association, through New York State School Board Association. So, you know, we are not just sitting here stoically without compassion, because we all are parents and we all understand this.